I have COVID, fuck, 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 fuck. I just think it's a lot of anger. And I think that there's a disconnect in public messaging, and the messaging has been that if we did all these things, we might be able to avoid it. Of course, I think since last year, it's become abundantly clear that vaccines cannot halt breakthrough infection. They are incapable of fully halting breakthrough, and with repeated exposures and enough time, breakthrough is inevitable. We will all eventually have a COVID-19 breakthrough if we live long enough. But I do think that being pissed at the entire world and humanity seems disproportionate. Pissed at selfishness and refusals to vaccine or mask. I guess this strikes me as problematic because it's more than likely that it was a vaccinated person that spread COVID-19 to this person. The biggest piece of misinformation is that if you did everything right, you wouldn't get COVID. And the second biggest lie, which is that if you get COVID, it's because of what the other people did, the bad people. And those are two of the most harmful pieces of misinformation. And it's harmful when the average person holds that view, but it's even more harmful when a doctor holds that view. And it's particularly harmful when a doctor who cares for COVID-19 patients is saying that kind of language. I mean, I worry about these patients. Would I want my mother or father, if they happen to choose not to vax, under the care of a doctor who had so much contempt or hatred for people who are unvaccinated? And to me, it's kind of scary, actually. It's scary in a way I've never seen in medicine. All these years of practicing, I'm in my, 17th year in medicine, watching doctors, being in the hospital, practicing as a fellow resident, attending for quite a while now, and I've never seen this level of hatred towards any group of people. I certainly wouldn't condone it. We always approach people with compassion. So to me, I guess I am troubled to see that this is somebody not only who has these strong feelings, but is taking care of people who have survived COVID-19, some of whom may have been not masking to this doctor's satisfaction or not vaccinated to this doctor's satisfaction. And I worry about those patients, and I think I would be really kind of troubled if it were my loved one. I would honestly feel deeply concerned about their care and conduct of the patient. I would want to investigate if they were providing impartial care or discriminatory care against people who were unvaccinated. The ABIM wants to regulate misinformation. The ABIM needs to investigate doctors who use such hostile terms for patients. I think that's always inappropriate. We should not judge people for how they ended up in our emergency rooms in hospitals or in clinics. We should provide them the best available medical care. And I think these sentiments are reflective of a broader anxiety and a broader rage, a broader hatred and antipathy amongst each other, and is also part of the reason why our policy was so difficult and we couldn't have conversations, because people have this kind of emotion that they're bringing to the table. I think the best way to think about health policy is absolutely dispassionately, and to consider the numbers, to consider the facts, to consider the data, and to consider what studies might reduce uncertainty. And that's what I hope to bring you. So those are my thoughts. Angry doctors put a chill down my spine. I'm pretty concerned about it.